Good afternoon and welcome to our series of webinars focused on bringing you information about COVID-19, infection control, and other nursing home related topics. The information in these weekly webinars is geared toward long-term care and skilled nursing facilities, but we encourage everyone who's interested to attend. My name is Katelynn. I'm a communications specialist with Quality Insights. Today's webinar is Spotlight on Sepsis, Understanding the Vulnerability of Patients Receiving Dialysis. Everyone has entered the meeting on mute, but we will have a Q&A following the presentation. If you have questions or comments, please submit them using either the chat or the Q&A tool in your Zoom menu. We invite you to join us every Wednesday for more of our weekly webinars. Next week's topic is multi-drug resistant organisms in nursing homes. If you're interested in joining, that will be the same time and place next Wednesday at 2 p.m. And now I'd like to introduce our guests today, Katelynn Booth and Jennifer Brown. Katelynn Booth is a quality improvement specialist and has been with Quality Insights Renal Network 5 since June of 2021. Katelynn's experience includes trauma PCU and ICU, continuous renal replacement therapy, interventional radiology, vascular and dialysis access. She also serves as president of the American Nephrology Nurses Association Old Dominion chapter. Katelynn graduated from Jefferson College of Health Science in 2011 with a bachelor's degree in nursing. She later graduated from Liberty University with a master's in nursing education in 2019. She recently obtained her certified professional in healthcare quality through the National Association of Healthcare Quality, or NHAQ. Jennifer Brown is a quality improvement specialist and infection preventionist at Quality Insights. She is a registered nurse with over 10 years of experience in a variety of healthcare settings, most recently as Director of Staff Development and Infection Prevention in Long-Term Care. She has also led several quality improvement and infection control initiatives in acute and ambulatory settings. Jennifer and Katelynn, thank you for joining us today.
Thank you, Kathy, for that introduction, and thank you to Jennifer for the collaboration putting this webinar together. This is an extremely important topic. I don't think we can emphasize the risk of sepsis enough in healthcare. And this particular topic in regards to dialysis patients has become something that I'm very passionate about. So let's get into this. Next slide, please. I have a few learning objectives today to keep myself on track. Some of these items may be a review from the previous sepsis webinars that have taken place in the month of June, but that's okay. We'll talk about the different types of hemodialysis access, summarize the cause of the increase of infection, identify signs and symptoms of sepsis in the patient on dialysis, understand how those sites become infected, and then probably the most important thing, we're going to talk about the preventative measures that can take place. Next slide, please. So what is sepsis? You can look on the internet and there are a lot of definitions. They're worded differently, but they're all kind of the same. I am looking at the CDC's definition, which is probably the most basic. It is the extreme response to an infection. So it's a life-threatening medical emergency, and it happens when you when an infection you already have triggers a chain reaction throughout your body. Next slide, please. Who is affected? So really anyone can be affected by sepsis, but there are populations that are at higher risk. And I won't read through every bullet point here, but I did highlight 3 and 4, people with compromised immune systems, and then those with chronic disease, such as kidney disease, which is going to be our primary focus today. Next slide. So the signs and symptoms of sepsis, again, these are probably not new to you. They do vary based on the individual and what type of infection they started out with and their body's response to it. But we see altered mental status, change in body temperature, tachycardia, chills, shortness of breath, and hypotension. And I specifically want to mention a couple of these, hypotension and shortness of breath, because I know I've done this myself working in the hospital. I've looked at those symptoms as, oh, well, they just had dialysis. Those are very typical symptoms of a patient that's just dialyzed. They're hypotensive because maybe too much fluid got pulled off. Or on the reverse side of that, maybe they're short of breath because they need a treatment. They just need a treatment. That's why they're short of breath. They've got some fluid overload. So I think those two symptoms in particular can be overlooked in the dialysis population because we tend to see those as typical symptoms. And that's true, they are, but they can also be symptoms of sepsis. Next slide, please. So what makes this patient more vulnerable? So CDC is where I pulled this information from, and they did a study between the time of 2017 and 2020. Adult patients receiving dialysis were 100 times more likely to develop a bloodstream infection related to staph compared to those adults that are not receiving dialysis. So why is that? And when you think about it, a dialysis patient, and this is a hemodialysis patient, this is not taking into account peritoneal dialysis, but a hemodialysis patient, when their bloodstream is accessed 3 to 4 times a week on average. So with every puncture, there's a little bit more of a risk for a bug getting into the bloodstream and causing sepsis. And then in addition, they have all of these other comorbidities that go along with their kidney disease. They have decreased immunity, and that makes it even more difficult for them to fight off an infection. So this is an extremely vulnerable population. Next slide. So the most common causes of infection, and again, the focus here today is on hemodialysis. Peritoneal dialysis patients, they also come with an increased risk through skin infections and peritonitis, but today we're talking hemo. So central line associated bloodstream infections, we know them as CLABSI or BSI, and then skin infections at the access site. And this can happen with catheters and with fistulas and grafts as well. So the picture you see here, that is a patient with a hemodialysis catheter, and you can tell it's red, it's crusty at the site. This is definitely an access and a skin infection at that access site. So let's talk a little bit more about why each one poses a risk. So if you go to the next slide. These are the types of hemodialysis access. So you can see the chart. This was provided by the CDC. A fistula is the lowest risk of infection, and then all the way over to the right, you have a central venous catheter. We call them CVCs, or sometimes we just refer to them as catheters. They have the highest risk of infection. So why is that? A fistula is a procedure done that joins an artery and the vein, but there's no foreign body in there. So no foreign body, you still have a risk of infection, but it's less likely. A fistula is the preferred access for patients. And then you have a graft, so that's a moderate risk. That joins an artery and a vein indirectly by placement of a tube. And I don't know if you can see the picture, if you can zoom in on it or not, but there's a little tube that connects that. So a foreign body is now inserted, and that increases the risk because our bodies are not supposed to have tubes in them. And then all the way to the right, you have thank you, Kathy, for zooming in on that. If you can see that circled area where you see graft. And then on the right, catheter, so the CVC. So you have a tube that's inserted through the chest or the neck, and the tip of that catheter is resting in the superior vena cava or just above the heart, if you can see in the picture there. So the tip of the tube is placed just above. So then we've got a double threat now. So we've got a foreign body in the tube that's inside your body, and then it's placed in a large vein. So that catheter is it's pumping directly into the bloodstream. So anything that might get stuck in that catheter has a direct line to the heart. So you can see why that is an even greater risk of infection. Next slide. So the anatomy of the central venous catheter. So there's a few different places that physicians will put them in. The subclavian is the preferred location, and that's in the chest area. You can also see them in the neck, and then the femoral. So femoral caths are used as a last resort. They do present the highest risk of infection. So if you have a catheter in your femoral artery, right in your groin area, that location tends to get a little more sweaty. The dressings often do not stay in place as well in those areas. So that is a last resort if a patient needs access. They can be tunneled or non-tunneled. So looking at the pictures on the right, you see the tunneled catheter, the picture on top. So that is access to the vein is separated by a track under the skin. And this is better suited for long-term use. So we prefer them to have a tunneled catheter. So the incision is made in the chest, and then the surgeon will create a little path before the catheter is actually inserted into the vein. So it's still a very high risk for infection, but it is preferred over a non-tunneled catheter. So if you see the bottom picture, that is a non-tunneled catheter, and it accesses the vein right at the point of insertion. So the surgeon cuts right above that vein and inserts the catheter. So there's less area for a bug to get in there and infect the vein. And it's really important to understand the anatomy of the catheter and where it's placed and whether it's tunneled or non-tunneled, because knowing the location and the type of catheter your patient has can help you take the additional preventative measures to prevent it from getting infected. Next slide, please. So how do these sites actually become infected? So for the fistulas and the grafts, what we see is the dressings are often left on longer than the recommended time. So when your patient comes back from dialysis, they really should have that pressure dressing removed within the first few hours of being back. We do see patients come back and they've got that same dressing on. So maybe they get they got dialysis on Monday, they come back for their treatment on Wednesday, and the same dressing is on that site. And that can lead to an infection. Or the access sites are not cleaned properly before the site is accessed. There is a specific protocol that dialysis nurses must follow to aseptically clean that site before they stick the needles in. But also we have patients that, when those access sites scab over, they're pickers and they will pick at the scabs and their hands have germs on them, and then it leads to a skin infection. Now with catheters, the most common thing leading to infection is probably the soil dressing. So if dressings become wet, dirty, or they're peeling off, again, patients are picking at the dressing, so they're not staying in place. You have to keep reinforcing it. That is a breeding ground for infection. The ports, if they're accessed without proper aseptic technique, again, there is a whole protocol on this process. You can't just, swipe it with alcohol real quick and inject. There's a whole process to disinfecting it. Improper dressing changes. So the dressing's being changed, but maybe it's not being changed correctly. If the nurse and the patient don't both wear a mask during the dressing change, any air that gets on the access site from the patient or the nurse can cause an infection. Or if they break sterile procedure, maybe they accidentally touch something with their sterile gloves and then touch the dressing kit, that can lead to an infection as well. Improper use of the catheter. So if you do not have a specific order from the patient's nephrologist to do blood draws or give medication, that should not be accessed. The catheter should only be accessed by the dialysis team during dialysis. And something that patients hate about having a catheter is they really should not shower. Patient showering, if it's not covered properly, and it's really hard to cover the dressing where 100% it is not going to get wet. It's very difficult to do that. The patients don't like this. They hate it. They can't get in the shower because they can't get it wet. They can sit, if they have a chest or a neck catheter, they can sit, if they have a shower chair, and they can kind of rinse off if they have one of the shower heads that pulls down. But you can't really take a traditional shower without getting the catheter wet. When they become infected, when these accesses become infected, it really creates a snowball effect. So if the site's infected and it can't be used for treatment, that leads to, well, now they're missing a dialysis treatment because they can't, maybe they can't use their catheter. They'll have to go into the hospital, have the catheter replaced. They've got to do antibiotics, and it really just affects their treatment and their quality of life. So their access is their lifeline. All right, next slide. And I believe we're going to turn this over to Jennifer now.
Yes, thank you, Katelynn, for that wonderful overview. Next, we're going to talk about prevention strategies. Effective infection prevention practices are the cornerstone of any, infection control program. And it's especially important for those facilities who have residents who are getting, in-facility dialysis or going out for dialysis, to be aware of the vulnerabilities that come along with the treatments. So for this section, you have 4 critical strategies to help prevent infections for this vulnerable population. First up, we have hand hygiene. Hand hygiene is the single most important practice to prevent the spread of infections. We should always do comprehensive education and regular audits on proper hand hygiene techniques. They're essential for maintaining high standards. Something that no one, people get tired of hearing about it, but staff should always be trained to wash their hands thoroughly with soap and water or alcohol-based hand sanitizer, especially before and after resident contact, after removing their gloves, after touching potentially contaminated surfaces. And utilizing regular audits can help identify any gaps in compliance and provide opportunities for continuous quality improvement related to hand hygiene. The second prevention strategy is proper PPE. Proper PPE, the correct usage of PPE is crucial in minimizing the risk of infection transmission. Both residents and staff should be sure to wear masks when they're doing the CVC dressing change, if that's removed, to prevent any airborne contamination to that site. Also, gloves have to be worn whenever there's direct contact with the access site for dressing changes, for the CVC sterile procedure is required. The third area is environmental cleanliness. Maintaining a clean environment is essential to preventing healthcare-associated infections. For this, regular auditing is also really good to, help ensure adherence to your protocols that you have at your facility and identify any gaps. Always follow the CDC guidelines for environmental cleaning. That's crucial to make sure your cleaning procedures are up to date. And this includes using appropriate disinfectants, focusing on high-touch surfaces, and ensuring that your cleaning staff are well aware and well trained on your infection prevention techniques. So just be consistent and thorough in that education, and, making sure your processes are, in line so you can prevent, transmission of pathogens through that route. And also, I also want to mention, keeping your residents up to date with immunizations. That's vital in protecting residents from vaccine preventable diseases in this vulnerable population. Pneumonia is a extremely high risk. So making sure that residents receive their influenza, pneumococcal, COVID-19, all the required vaccines. That's going to be key in reducing the incidence of severe illness and outbreaks within the healthcare facility. So just regularly monitor and document vaccine status and help, maintain those immunization rates. Next slide. A little more about the fistula and graft sites, some prevention strategies to assist in, having infections in those areas. As Katelynn mentioned, which I always remove your post-dialysis pressure dressing within 4 to 6 hours. The dressing should never be left on until the next scheduled dialysis treatment. And also make sure that your staff is monitoring the access site for any signs of infection. So those signs can include redness, swelling, warmth, drainage from the site, and also discourage patients, residents from picking at scabs that can help introduce, infections from the skin and also from under the fingernails, and also just keep that area open so that infections can get into the site. So discourage them from picking the scabs. For catheters, ensure that dressings remain clean, dry, and intact. Make sure that the resident is being monitored for any loose dressings, or, if anyone is picking at the dressing, make sure that's addressed promptly. It's advised that the residents with catheters do not shower, only sponge bathing. And if they must shower the catheter, like I said, just really secured and made sure that there's no way that water can get into that area and contaminate that site. Never immerse the site in water. Ensure that the caps on the catheter tips are not removed, and do not use the catheter for blood draws or medication administration unless it's approved by the nephrologist. If it is approved by the nephrologist, make sure you have all the protocols from the nephrologist of how it's supposed to be handled, and make sure that aseptic technique is followed to the T. And both the resident and staff are wearing a mask during the dressing change, during the procedure. Next slide. So a little more about the CVC dressing change. If you find yourself in a situation where the dressing is compromised, something happened, the resident picked it off, or, it fell off somehow, that needs to be addressed right away. Immediately contact the dialysis team and follow their guidance. Facilities have pre-established guidelines for these situations. They can provide you with literature to keep on hand, so that if this situation does arise, you'll know how to handle it. Make sure that to change the dressing, this must be performed by licensed staff, and ensure that you're following CDC guidelines for aseptic technique. This procedure is considered competency-based skill. So if you have staff that will be performing this dressing change, make sure that they are competent, and they've been thoroughly educated on the procedure, and that they have the competencies recorded to ensure that they know the procedure and it's done correctly. And also communication is key. Make sure the dialysis team is aware of the compromise so that they can perform any additional monitoring of signs of infection after the exposure happened. Next slide. So here we have some staff tools and resources, and I will hand this back over to Katelynn so she can talk about some of these here. And
Thank you, Jen. So I really believe that one of the best ways to stay on track is by doing random auditing or having checklists that you can go through. So I've included some links here. I know you can't click on these right now, but we can get these to you. These are straight, not all of these, but most of these are straight from the CDC website. So exit site care for the hemodialysis catheter. So if you do have staff in your nursing home facility that can change the dressings, if you've got an agreement with the dialysis facility that they say, yes, dressing's compromised, it can be changed. You may want to check out these lists and these tools just to make sure that you're following all the correct steps. I also don't think it's a bad idea to do hand hygiene audits randomly just to make sure that people, especially as new staff come in, we get busy, we get a little jaded, we say, oh, it's not going to be that big of a deal if I don't foam out this time or foam into the room. I'm just walking in the room to hand them something. I don't need to foam for that. We can become we get busy and we let those things slide by. We really can't afford to let those things slide by. So doing random audits, don't let anyone know that you're doing them. Have someone different do them each time and kind of put your detective hat on and make sure that everyone is doing hand hygiene properly. I think that is, like Jen said in the preventative slide, that is the foundation for infection prevention. We can also do CLABSI surveillance audit. So this is a link here that will, it's an audit tool. It's very similar to the hand hygiene audit tool, where you can go into say you have 3 patients with a dialysis catheter. You go in and you make sure the dressing's clean, dry, and intact. It doesn't look like it's peeling up anywhere. The caps are in place. You can kind of routinely audit those to make sure that you're not missing anything with those patients. Education, super important. We have, through Quality Insights, some ADISCO modules. They are all about dialysis access care for nursing home staff. So these modules get a little bit more into the weeds than what we've covered today. This was an overview, but I want to say it's 3 modules. I could be wrong about that. There's a few in there that are all about access care, and I really encourage you to complete those and have your staff complete those as well. And then something else that we really encourage are ICAR assessments. So infection control assessment and response. So each state offers a free consultative, non-regulatory assessment of infection control practices at your facility. We have a lot of our dialysis facilities that participate in this, but it can also be done in the skilled nursing facility side as well. So this is a way, it's non-punitive. So someone can come into your facility and they can review all of these infection control things and tell you areas where maybe you need to enhance the practices. They'll give you a report after they've completed it, and it really pinpoints areas for you and your staff to work on. So I like to say it's a non-stressful way. I'm sure it's still stressful having someone come in and look at your processes. But again, they're not going to report you to the state for anything. It's purely really educational and to help you enhance. If you were surveyed by the state, then you'd be more prepared for it. That's how I like to look at it. Next slide. So I couldn't include the picture on here, but we'll make sure that you have the link to this. So the second bullet point here is an outpatient dialysis early warning screening. So we have a lot of our dialysis facilities use this tool, but it can absolutely be used on the SNF side as well. So what it is it gives you a list of things to pay close attention to for the patient on dialysis. So their heart rate, how do they feel? It has you check their access site. Does it look infected? It goes through all these things. You check some boxes and it will give you a score. And then that score determines what action you might need to take. So if the score is above a certain number, then you need to contact the patient's nephrologist and say, hey, I've scored them on this early warning screen tool, and I'm concerned that they have an infection. I'm concerned that they have possible sepsis, and really get the ball rolling on that before it goes south and they end up in the hospital in the ICU. The other one, Jen, I think this was one that you shared the flyer.
Yes, so the other flyer is for our collaboration with Vivint Health. Vivint Health is a company who provides infection control training for staff and residents and their family members. So it has information and sort of fun, interactive modules so that people can be more comfortable with infection control procedures. If you're out and about in the community, if you're in the facility, and also hand hygiene, just a different way to present the education to your residents and staff to keep them up on those prevention procedures for containing infections within the facility.
We can go to the next slide. There's a couple more resources to go over. Yes, so for patients, the stoplight tool is fantastic for your patients that are not cognitively impaired. So the green zone, it's just that there's stoplight tools for a lot of different things out there. This one for sepsis, in the green, I don't have a fast heart rate. I feel good. They're not concerned about anything. And then in the yellow, it's telling them when I have, XYZ symptoms. This is a cautionary thing. I probably need to let someone know how I'm feeling. So again, we can stay aware before things get really bad. And then if they're in the red, they probably need to go on to the hospital if they're experiencing anything in the red. And I know the picture's kind of small, but we've included the link so that you can access that. This is a great patient, not just for your dialysis patients, but for any patient, because yes, dialysis patients are way more vulnerable, but any other patient in the nursing home can also get an infection and get sepsis, as you know. So this is also a fantastic tool for all the patients in the nursing home. And then for the patients with catheters and fistulas and grafts, so the top portion of that next resource in the green, that is tips for patients on how to keep their catheter infection free. And then on the bottom, how to keep your access infection free. Some little tips. Again, this is a CDC resource, so you can go right on the CDC website and print these out. And then on the right, another resource for patients to understand how infections are prevented by washing hands, because it's not just the healthcare providers that need to constantly keep our hands clean. The patients need to do it too, because especially if you have those picky patients like I was talking about, if their fingernails are dirty and their hands are dirty, they are introducing the infection themselves. It's not coming from us, it's coming from them. So hand washing, again, it can't be stated enough how important hand washing is. And next slide. So that is all that we have. So if anyone has any questions for Jen or I.
All right, thank you. So I will be emailing the slide deck to everybody who's registered here today later this week, and you'll be able to get to all of those resources and the links. So yes, we will begin the Q&A here in a moment. If you have a question, please submit it using either the chat or the Q&A tool, or you could raise your hand if you'd like to ask your question out loud. I'd again like to invite everybody to our next webinar next Wednesday, which will be on multi-drug resistant organisms in nursing homes. So that will be next Wednesday, July 3rd at 2 p.m. We also invite you to bring your questions to our virtual live chats every Tuesday and Thursday at noon. One of our quality improvement specialists will be there to answer your questions on topics such as quality improvement initiatives, infection control, or MDS coding. You can find the links to our live chats and our webinars in the newsletter we send out every Friday called the Last Minute Lowdown. And if you'd like to be on that mailing list but don't think you're on it yet, you can email me at ccaudill@qualityinsights.org, and I will get you on that list. And I will drop my email in the chat shortly along with Katelyn's and Jennifer's. I don't see any questions so far. Katelynn and Jennifer, do you have any closing remarks you'd like to make while we wait?
I would just state again the importance of communicating with the patient's dialysis clinic. If you're concerned about anything, it is better to be cautious, overly cautious, than to, potentially let something slide by. I really emphasize the importance of the catheter dressings. This has been a common thing that we hear when we go into the dialysis facilities is the patients, come back to treatment and the dressing's peeling off and they didn't know about it, or maybe the facility changed the dressing, but there was a breach of some sort and they didn't know about it, and the patient ends up with a catheter infection. So really over communication and being overly cautious, I think, is what I would emphasize here. Let them know so they can take the proper steps.
Jennifer, did you have anything you want to add before we wrap up?
Now, the only thing I wanted to say is, those infection prevention strategies are very important, especially the hand hygiene and making sure that staff is educated on this, care of the dressings and those, specific things that are unique to our dialysis residents. And if anyone has any questions, if you have, questions about starting up competency, I'd be happy to help out with that.
Thank you, Jennifer. And it doesn't look like we have any questions for today, so I will go ahead and wrap us up. Before we sign off, we'd like to ask everyone here to please answer a short evaluation of today's webinar. It is anonymous and will show as a pop-up as soon as the webinar ends. So if you have a couple minutes to fill that out, we would appreciate it. Katelynn and Jennifer, I'd like to thank you both for joining us this week. And I'd like to thank everyone who attended for today, and we hope to see you again soon.